Eric from Have Dummy Will Travel here, Chief Emergency Expert. We're going to talk today about albuterol. Lots of folks have these inhalers in their drug kits, and unfortunately, if you use it once, you got to throw the whole thing away. Also, there's like 200 doses in here, and hopefully you'll never have to use that in a dental setting if we're in an emergency. So I have something that's a little bit of a better option. It's nebulized albuterol. It does require you to have an oxygen tank, but frankly, you should have that anyway. Here we have a nebulizer. It comes as 5 different pieces. There's a medication bowl here. You just unscrew that. The nebulized albuterol comes in a little vial as such. And you can just twist the vial, put the contents into the bowl. And it takes a couple of squeezes. Screw the top back on. And then there's a T piece, a mouthpiece, and a reservoir. I'll show you what that's about in a second. I'm going to take the oxygen tubing and put it on the bottom of the nebulizer. Now we're ready to go ahead and connect to our oxygen source. So here, this should be on. All right, so we're going to turn a quarter turn to the left to make sure that it's on, and we're going to connect this hose to the hose bar up here, and we're going to set this at 4 liters per minute. There I have 4 liters per minute. And if you notice, coming out of the nebulizer is a little bit of mist, much better than a powder spray that's going to spray onto the back of somebody's throat. But this mist can be inhaled and goes right down to where it's needed. Much better option, much cheaper option, albuterol nebulized.